Welcome to the LDN radio show, brought to you by the LDN Research Trust. I'm your host, Linda Elsiegood. I have an exciting lineup of guest speakers who are LDN experts in their field. We will be discussing low dose naltrexone and its many uses in autoimmune diseases, cancers, etc. Thank you for joining us. This show is sponsored by Cussler's Compounding Pharmacy and Clark's Compounding Pharmacy. They are more than a drugstore, they are highly trained compounding pharmacy experts, combining the art and science of preparing personalised medications to meet your specific needs, improving lives by solving medication problems for people and pets, creating solutions to medication challenges. Visit cuslerspharmacy.net, which is KUSLER pharmacy.net. Today I'd like to welcome my guest, pharmacist Dr. Dawn Ipsen, who is not only the owner of one compounding pharmacy, but two compounding pharmacies in WA, Washington State. Let's get it right. Thank you for joining me today, Dawn.
Well, thank you, Linda, so much for having me. It's an absolute pleasure.
Great. So, tell us, we're all interested. What made you decide you wanted to be a pharmacist?
Oh, yes. So I knew at a pretty early on that I wanted to be in healthcare on some aspect, and pharmacy was very intriguing to me and started on that path. And lucky for me, I got an opportunity to be a compounding pharmacy intern while I was in pharmacy school in a compounding pharmacy, and immediately fell in love. And so that was my path. I loved how personalized it was, how unique it was, how I was doing things that none of my classmates and colleagues were doing. And so that started my journey. This was in the Seattle area. I went to the University of Washington School of Pharmacy. It was almost 20 years ago now, and got my doctor in pharmacy degree there, and have enjoyed it thoroughly.
Mm-hmm. So how did you get from pharmacy school to owning two compounding pharmacies?
Yeah, so I've always been an entrepreneur and really loved business sides of things, and kind of had this long-term goal that at someday I was going to own a pharmacy. And it definitely happened earlier in my career than I expected. I had been working for the Kusler family at Kusler's Compounding Pharmacy, and had always told them, when you're ready to do something else, keep me in mind. And got that call and became owner of Kusler's Compounding Pharmacy. And gosh, Linda, that was almost 6 years ago now, and was just minding my own business, running my pharmacy, helping my community, doing great work. And a couple years into that, received a call from another owner, the owner of Clark's Compounding Pharmacy in Bellevue, and he was looking for a buyer. And he wanted to retire, and he'd done his research and determined that he thought I would be a good fit, that I did the kind of pharmacy work that he liked to do, and I helped people the way that he felt was the best way. And so I've owned now Clark's Compounding Pharmacy in Bellevue, Washington for 3 years. And even though the pharmacies are only 25 miles apart, they, kind of do similar but yet different things. They're both compounding only pharmacies, non-sterile. Kusler's does contract with some insurance plans, so we do help patients with that. And in Clark's, we actually are licensed in 9 states, so we work with patients in not only Washington State, but Oregon and Idaho and Arizona and Nevada. And we have Colorado and a couple other states as well. So that's been really wonderful, great and fun and challenging, and it's just really neat that, I get to use my really strong chemistry and biology background and help people really solve medication problems. And for people and pets, we help the whole family, so that's intriguing and fun.
Wow. You never know, it's been 3 years, you might get another phone call from another pharmacy.
You never know. However, my staff might call the crazy people if I do that. But no, I enjoy it and I love the challenge, and I think that it's something that we're really successful at. We pride ourselves in the quality and our teamwork and how we take care of patients, and that we treat our patients like their family and like we would want our family to be treated, and very personalized with that care.
So, with all your compounding, what forms do you compound LDN into?
Yeah, so Low Dose Naltrexone, that's ever expanding, actually. I've been working with Low Dose Naltrexone for roughly 10 years now, and decided to become a state expert in Low Dose Naltrexone about 5 years ago. And back then it was very primarily capsules only, and that's what we saw. And actually 5-10 years ago, as you know, Linda, even the doses were very, just structured, just certain doses, not a lot of variability to it, cut and dry. And we've learned so much, right, over the research and over the years. And so now we're doing a much wider array of doses, everything from teeny tiny, itty, ultra low or micro dosing for maybe patients who are on pain therapies already and needing some extra help with their immune system, to even much higher doses, more frequent doses for, mood situations or post-traumatic stress or depression. And along with that, we're also doing, helping patients like pediatrics who maybe there's an autism spectrum situation going on and they don't want to or aren't willing to take capsules, in which we're able to make flavored liquids, and we're able to do naltrexone in a transdermal. And a transdermal is very different than just a topical. This is a cream base that's very special, and it's designed to drive the drug into the body. But it's a great way to go when you have a patient who won't participate or can't participate in taking an oral medicine. And on top of it, we've started doing a lot of topical naltrexone treatment for skin conditions specifically. So for like psoriasis, eczema, things of that nature. So those are primarily the most dosage forms we see. So different ways to do oral, different way to do a transdermal, and then we have the topicals as well.
If I could just ask you, the topical cream, is it a cream or a lotion? What do you call it? Topical?
Yeah, it's usually a topical cream. Like for skin dermatology conditions. Yeah.
Yep. So if you've got eczema or allergies or psoriasis and the other skin conditions like Bechet syndrome, Hailey-Hailey's disease, applying that directly to the skin, what do you see? Does it take away the itchy, flaky redness? How does it? What do you see when people use it?
Yeah, definitely. So what we were noticing is in psoriasis patients that were just on oral low-dose naltrexone, that they would typically get to effect at some point, but it took a very, very long time. And it was, as you can imagine, hard for patients to be patient, so to speak, and wait for that, because, I mean, we all know how miserable it is to have skin that's irritated, it's red, it's inflamed, it itches, it burns, it stings, all those things. It's very difficult to have any sort of quality of life. So we started doing both. We would help doctors with the normal oral therapies that we would be used to seeing, but then we would start making a customized cream for them, naltrexone being one of the ingredients. And we would put it in a cream base that actually had nutraceutical components to it that would help calm the skin already on its own with no drug in it. So yes, they often just with the naltrexone and that cream base would find relief of redness and inflammation, and we'd start seeing healing of autoimmune skin disorders much faster than if they were doing the oral alone.
Mm-hmm.
On top of that, we could more closely meet their direct needs. So if it was causing pain, we could add an ingredient to help with that. If it was a histamine reaction, we could add another ingredient to help with that. And so it gave us a lot more flexibility to be very, very specific and customized with the treatment they needed on the skin that was bothering them.
Mm-hmm. So my question would be, Dawn, if, for example, 3 milligrams, the highest dose that you could tolerate orally, and you're putting a topical lotion or cream on, does it matter how much naltrexone is in that cream? Does it get absorbed into the system? How does it work? Do you see what I'm saying? If 3 is all you can take and you've got 3 in the cream, does it matter?
Mm-hmm. Well, it depends. So if we are doing the topical cream base, there's a slim chance you could have some added absorption, but then we may want to go back and talk about, well, what does it mean they couldn't tolerate more than 3? Mm-hmm. Was it directly affecting their stomach and they were having, nausea or cramps or something like that? Or was it affecting sleep? Or why was it 3 was their oral ceiling number, right? Mm-hmm. So when we go topical or even transdermal, a lot of times we can augment that dose and go higher than one would have thought than they could do orally and still avoid the side effects because they're avoiding that, what we call in pharmacy, the first pass effect of when a drug is swallowed, it goes to the stomach and then it goes to the liver. And that's sometimes the portion of the system that's causing the side effect. And if we're avoiding that, we can get away with that. The other thing is that given in these dermatology conditions, if we're doing naltrexone and it is just topical, we're not getting the systemic absorption that we would be getting in, say, an oral or transdermal delivery. So in that sense, the amount probably doesn't quite matter, but also the amount of drug that's in that cream, they could put quite a bit on and not be getting a significant dose directly into their bloodstream.
Mm-hmm. Okay. And then would it be exactly the same as oral LDN, that if it did get into the bloodstream, it would be there and then go quite quickly?
Right. So if it did go into the bloodstream or it was a transdermal delivery where it was driven in intentionally, you would expect to get same effect as if they were on oral. Mm-hmm. You may avoid side effects of stomach directly because, again, you're not putting that drug directly in their stomach, and that can be helpful for some patients for sure.
Mm-hmm. Okay. Now, patient feedback, what has been the outcomes of your patients taking LDN?
The feedback has been very, very positive. It definitely seems to be a drug that is extremely safely tolerated with very few side effects, if any. And if there are side effects, they're typically dose related and things that can be managed by proper titrations and proper dosing. The benefits can be anywhere from subtle improvement to very profound improvement with a huge direct link to much better quality of life. Even on my more subtle improved patients, they often find that their improvement was way more than they anticipated because they'll sometimes take a vacation or a holiday from LDN and realize, gosh, my symptoms are coming back. I'm not feeling as good. I'm more fatigued, on and on. And then when they restart low dose naltrexone, they can then more clearly see how much benefit it was providing to them.
Mm-hmm. And what conditions would you say your patients are taking LDN for? Do you know that?
Yeah, I often do know that. Of course, we have our long-term patients that have been on it for, 5+ years at this point that had the fibromyalgia, multiple sclerosis, and then Crohn's disease, of course. We're seeing even more, though, with conditions that are just in general inflammation-based and in which we're trying to control the body's autoimmune system. So Hashimoto's and Graves', Lyme disease, rheumatoid arthritis, We have patients that are using it, like I mentioned, for psoriasis specifically. And then more recently, in the last couple of years, we're seeing patients that do have post-traumatic stress disorder or depression that has been refractory, not responded to normal therapies, and even cancer conditions that have been very, very helped by low dose naltrexone. So,
do any of your doctors around your area prescribe LDN for infertility issues?
We don't have too many in our area that are doing naltrexone for infertility. However, it's definitely known, it's definitely talked about. There's pretty good literature on its use. And it just might be that I'm not right next to where the infertility clinics are that are working with that.
Yeah. What about mental health issues?
Yes, we definitely have doctors who are using this for mental health issues and are really trying. It's great because they're really actually trying to bring to light the whole topic of mental health and how important it is. And they become so much more open to other ways of thinking, other treatments, other modalities for these patients. So, we're seeing things like the use of ketamine for depression. We're seeing the naltrexone being used for depression and PTSD. And I can honestly say that I've had patients who have been very concerned about their well-being, and that once they work with these types of providers, down the road, their quality is just so much better and they're doing great with it.
Mm-hmm. And of course, so many mental health issues with antidepressants, etc., can make people feel a bit sluggish and drowsy. Where naltrexone actually makes you feel brighter and better, and it's not addictive either.
Right. You get that endorphin release, which is so important to our well-being and how we feel and our motivation and our willingness and desire to interact with others in our community. And those are all such important things for being, part of this world.
Mm-hmm. Do you have any patient case studies you could share with us?
Oh, sure. Yeah. A couple of my favorites is one, I do have she's a younger patient, actually. She's only in her 20s, and she comes into the pharmacy, and she's been coming in a long time getting naltrexone. At this point, it's usually just quick pickup. Hey, how are you? And out the door we go. And I was at the counter with her, and I literally had to stop and scratch my head, and I couldn't. She looked just so great, so normal, so just young and vibrant. And I honestly couldn't remember why she had even started low dose naltrexone. And so I asked her, can you remind me, why do you take the naltrexone? What is it doing for you? And she's actually an MS patient, a multiple sclerosis patient, which we actually have a lot of in, Washington State because of where we're located and our sunlight exposure and vitamin D levels and all that. And it's got her completely in remission with, her vitamin D and other things she's doing as well. But she looks just so normal is the only way I can describe it. And how cool is that? That here we have a 20-something who is able to be a vibrant member of the community and have a well-rounded life and do what she wants to do. So she's one of my favorites because it's oh man, thank goodness. And thank goodness you're staying on it to help, slow any progression of the disease process that might occur later on. And then I do have, one psoriasis patient that I've never seen psoriasis like this before. She actually had it even on the back of her calves, which is an unusual location, and started the naltrexone, did that for about a month, just the naltrexone orally itself. And then when we added in the cream, and when she would come back for refills, I just couldn't get over it, how fast it was healing. And we marked it. I actually took, with her permission, took pictures of when she first picked up and then when she came in for refills, and then now there's nothing left. So it's been really awesome to see somebody who had been dealing with this for most of her life who now is doing great, well controlled. Her immune system is just functioning properly.
Mm-hmm. How long did that
Yeah.
take, would you say, Dawn, before, her skin looked normal again?
Yeah, so skin is always slow. I mean, if patience is a virtue, it's on any skin condition, is you have to allow for the full derm cycle, which usually is right about 6 weeks, on average. And so, you start in with treatment, and you at the beginning are just trying to get the treatments on board and help with any symptom relief they might need. And then usually, like in this particular case, it was right about at the 3-month mark that she was coming in happy that, the condition was starting to reverse and go back to how skin was supposed to be. And then, of course, for full healing, it's another month or 2 after that. And then you go into maintenance mode at that point.
Well, that's amazing, isn't it? I mean,
it is.
Psoriasis, if you have it, and I know somebody with psoriasis, how embarrassing it is. People look at you when it's really bad. And it's not comfortable either, is it? Other than how it looks. So something that can heal and clear that up, it's amazing.
Yeah, it's wonderful because it can be, like you said, not only visibly unappealing, and they will often try to hide it if they can with clothing and coverage, but it hurts, it cracks, it bleeds, it burns, it itches. It's just horribly uncomfortable and unrelenting. It doesn't just stop. It continues. So.
Do you have many children as patients?
We do. We actually work with some doctors who are very in touch with the pediatric population, and that's their specialty. And they use naltrexone usually in those kiddos that have some sort of a spectrum disorder where they're needing the assistance with, like, they're non-communicative and they aren't interacting as we would hope they would be able to. They're a great population to work with, and that's where we get to become very creative and work really closely with the family itself on determining, how does this child want to receive its medication? And is it as simple as custom dosing and they can do a capsule? Great. And maybe they want the capsule a certain color because it might be more appealing visually to them. Fine. Perfectly great with that. Or do they need a liquid, and do they want it to be flavored a certain way? Or do they need a gummy troche or a lozenge? And then for the most difficult of patients, we can do the transdermal cream delivery. That I even have a couple of families that they actually apply it to the child's back skin area at night when the child is sleeping, so they can receive their dose that way.
Mm-hmm. Wow. So what else do you know about LDN that you haven't shared with us?
Yeah, so, with LDN, there's lots of things that can augment the therapy of LDN and getting the most out of it. And it's really looking at the patient as a whole and trying to discover what ways can we reduce inflammation load in that patient's body. So along with optimizing the dosage form and the regimen and the strength and the timing it should be taken, I do work a lot on talking with patients about the importance, especially in Washington, of vitamin D and the importance of good gut health and probiotics. And, we're working more with patients on using full spectrum CBDs to help with pain and anxiety as well. And, antioxidants and organic diet and how important all these things are to get inflammation loads down to get the best effect out of it.
Mm-hmm. Yes, diet is a big one, isn't it? People do notice a big difference by changing their diet.
Diet is so huge, and, us living in a suburban area, gardening and farming is not simple, right? And our seasons make that challenging too, and just really encouraging our community to buy from the farmer's market, get organic as much as you can, grow your food when you can yourself, and just eat well, take care of your body. You're worth it. It's like you are worth the extra effort in doing that.
And sugar is another big thing, isn't it? To try, if you can't, yes, if you can't cut it out, at least cut it down.
Right. And look for good alternatives that are natural. And if you do have to have that sweet, right? And because you're right, it's in everything and it's hidden often. It's hard to even know it's there.
It surprises me when you look at tin food. Sugar is in baked beans. It's in, just trying to think of something else that's slipped my mind. But soups,
condiments, salad dressing, and ketchup.
Exactly. Sugar. Sugar. It's not easy, but it's similar if you're buying foods and you read the labels. Gluten is in so many things.
Absolutely.
I mean, when I first started to be gluten-free, it took me ages to do my shopping, because I was looking at everything and trying very hard not to get anything with gluten in it. But it becomes easier because you know which things you can have and which things you can't have. Once you've gone through reading everything, it does become easier, and you do find alternative things. I use honey as a sweetener. I use coconut sugar, but it's a brown colour, so I can still make cakes and waffles occasionally, but they're a different colour. But if you close your eyes, you don't know. You can't see that it's a different colour. But you can be creative. It's very expensive though to eat organic here, and I should think it's pretty similar in the US, isn't it?
It is. It definitely can be challenging to be able to do that, and hard for some families to make that happen. And I always like to refer to the dirty dozen, as they call it, of if you really have to pick and choose which produce is most important to purchase an organic versus maybe you could save the finances on something else. That's a nice way to integrate or start into that pathway. And lucky for us in our area, at least, we do have a substantial number of farmers markets in our area that are all close by and available different days of the week and things like that, that can be an option for patients that are, really trying to do those things, but maybe not able to get it from the grocery store all the time. So.
And the thing is, with organic food, it doesn't last as long, does it, as non-organic? Well, that's been sprayed with things to keep it fresh longer.
Yep. And it sometimes doesn't look as pretty, does it, either? There's more bruises and scratches and changes in how it grows and things like that. But it's funny how our minds have, that used to be the normal, right? That produce always looked like that. And then we've changed to think that produce should look perfect in every instance, and that's not necessarily the case. So it kind of comes back to what you're saying with the sugar.
Yeah, we have a supermarket here that sells half-price vegetables from the supplier, and they're all packaged, and they're called wonky vegetables. So the carrots that are bent, parsnips that are probably, got a double part to it, that they're deformed, if you like, but they're perfectly fine. Yeah, there's nothing wrong with them. Yes. It's just, as they call them, wonky. They're not perfect, and I think that's great. But we've come to the.
It is good.
We've come to the end of the show, Dawn. So we could have carried on talking for ages. So we'll have you back again another time, and until then, stay well, and we will speak to you again soon.
Wonderful. Thank you, Linda. Have a great day.
Thank you. Bye-bye. This show is sponsored by Cussler's Compounding Pharmacy and Clark's Compounding Pharmacy. They are more than a drugstore, they are highly trained compounding pharmacy experts, combining the art and science of preparing personalised medications to meet your specific needs, improving lives by solving medication problems for people and pets, creating solutions to medication challenges. Visit kuslerspharmacy.net, which is KUSLER pharmacy.net.
Any questions or comments you may have, please email me, Linda, Linda, at ldnrt.org. I look forward to hearing from you. Thank you for joining us today. We really appreciated your company. Until next time, stay safe and keep well.